All right, today we're going to decode a really tricky group of skin conditions. These are conditions where the body's own defense system basically gets its signals crossed and starts to attack the skin. So let's dive right in. Just think about it for a second. What if the very system that's designed to protect you, your immune system, suddenly declared war on your largest organ, your skin? Well, that's pretty much exactly what's happening in this family of conditions we call lichenoid disorders.
Okay, so to really get what's going on, we have to zoom way in, down to the microscopic level. The problem starts at a very specific spot, which you can kind of think of as a border dispute happening right inside the skin itself.
At its heart, a lichenoid disorder is when your immune system gets confused. Your T cells, which are supposed to be the good guys, mistakenly see the very bottom layer of your epidermis, that's the top layer of your skin, as an enemy. And so they launch an attack right at that critical border between the epidermis and the layer just below it, the dermis. So the key takeaway here is that this is essentially a friendly fire incident. This border dispute creates a ton of inflammation, and it damages the very cells that are meant to regenerate our skin. And that, of course, leads to all sorts of rashes and other issues. So how on earth do we figure out exactly what's going on? Well, this is where the real forensic work begins. Pathologists take a tiny skin sample, a biopsy, and they look for clues under the microscope to solve the case. And boom, here it is. This image shows you the battleground perfectly. You see that dense, dark purple line? That's a massive army of immune cells, all gathered right at the border between the pink top layer, the epidermis, and the lower layer, the dermis. This is the absolute front line of the conflict. You know, a rash is really just a symptom. To get a real diagnosis, these skin detectives, we call them dermatopathologists, have to find a very specific pattern of damage. They're on the hunt for the telltale signs of a lichenoid reaction. And like any good detective, they have a checklist. First, they look for damage to those basal cells. Those are the frontline casualties in this war. Second, they're looking for that classic band-like infiltrate. That's the army of T cells all lined up at the border. And third, they look for something called pigment incontinence, which is basically melanin that's leaked out from the damaged cells down into the layer below. Now check this out. This slide gives us a perfect up-close view of that lichenoid infiltrate. And notice, it's not just a few random cells here and there. No, it's a dense, solid wall of immune cells literally hugging that border. This is the absolute classic signature of the attack. Okay, so once the pathologists confirm this general pattern of attack, the next step is to figure out the specific condition. You can think of it like identifying different suspects who all use the same method. The clues are just a little bit different for each one. Here are two really common members of this lichenoid family, lichen planus and lichen nidus. Now, on the surface, lichen planus usually shows up as these purplish, flat bumps. Lichen nidus, though, looks like tiny, shiny bumps. But the real giveaway, the thing that cracks the case, is what you see under the microscope. Lichen planus creates a sawtooth pattern in the skin layers, while lichen nidus has this super distinct formation that pathologists have an awesome name for. But before we get to that microscopic clue, let's just see what lichen nitidus actually looks like on a person. Here's a classic example. You can totally see those tiny, shiny little bumps all over the back of the hand. They might not even cause any symptoms, but their appearance is just unmistakable. And here it is, that fantastic description I was talking about. Pathologists know they're looking at lichen nidus when they see its signature claw clutching a ball appearance under the microscope. I mean, it's such a memorable and vivid image, right? And it perfectly describes what they're seeing. So what does that actually mean? Well, it means the epidermis, that top layer of skin, thins out and looks like it's wrapping around, just like a claw. A very neat, dense little cluster of those inflammatory cells. That's the ball. This unique structure is the smoking gun for lichen nitidus. Okay, now we get to the most important part of all. What does all this detective work actually mean for a patient? Well, it's everything. It's about using these microscopic clues to go from a diagnosis to a real, effective management plan. Let's bring this back to a real person. The source material talks about a 20-year-old who had issues on his feet. For someone who's dealing with a persistent, sometimes uncomfortable, and often really confusing skin problem, figuring out these microscopic clues is the whole game. It's the key to getting an accurate diagnosis. So the path from mystery to management is actually pretty straightforward. It starts with seeing a dermatologist who then takes a biopsy. Then our skin detective, the pathologist, gets the case. They analyze the sample. They look for that telltale pattern. Is it a sawtooth or is it a claw clutching a ball? And that definitive clue is what lets them create a really targeted treatment plan.
And that treatment plan, it's all about calming down that misguided immune response. For smaller, localized cases, the first line of defense is usually topical stuff, like corticosteroid creams. But for more widespread or stubborn cases, doctors might move on to systemic therapies. That's pills that calm the immune system from the inside, or even phototherapy, which uses specific kinds of light to treat the skin. When you just step back and think about it, it's really amazing, isn't it? A tiny little slice of skin can reveal this whole drama, an immune system fighting its own body at this microscopic border. And by learning to read the signs of that battle, we can understand, diagnose, and ultimately manage these really complex conditions. It's just a powerful story, all told by a few cells under a microscope.